Dear Mr. Stu, thank you so much for your channel and for your workshops. I attended one this summer and had a great time. Thanks so much, and I'm glad you enjoyed it. Hopefully some of the things that you learned you've been able to use. I'm writing to you because I have a question about my child. There have been some concerns raised by both myself and my partner and some school staff to the point where I think my child may need mental health medication. I was wondering, what are the steps to get my child medication? Any help you can provide is much appreciated. I'll be watching. Thanks so much. Thank you very much for watching the channel. And this is a question that I get all the time about mental health medication. So let me kind of break it down for you. Do not think that medication should be the first thing that we incorporate into a child's mental health plan. I think it should be one of the very last things that we incorporate if we choose to incorporate it at all. And there's many, many reasons for that, but a big one to remember is that medication is not a solution to a problem. Mental health medication doesn't make the thing go away or make the thing stop. Mental health medication is typically used to support a person who is so dysregulated or has so much disorder going on that they cannot receive the actual therapeutic help, that it prepares their brain to accept and be able to work with that therapeutic help. It is not a solution to things like ADHD and depression and anxiety. They can help support a person who is dealing with those diagnoses, but it does not make those diagnoses go away. And many times parents believe that things like ADHD, it should just be, let's give them a pill and then they're going to be able to focus. So medication is not a solution to the problem. It's a piece in a very intricate puzzle, and it's meant to be used for support, not as a solution. Another thing to remember is that medication, especially in my opinion and in the opinion of many trusted people that I work with, medication is for danger, not discomfort. If it is just an uncomfortable feeling of anxiety, or even an uncomfortable feeling of depression, or an uncomfortable ability to not be able to focus, whatever it might be, if it's just discomfort, we need to manage that through therapy and through other supports. Medication is meant for those danger situations where it would be dangerous for us to not provide this level of care for this person. Otherwise, something really intense could happen. And it doesn't have to be that it's a death or anything like that, but it would be something bad, something really bad will happen if we don't get this person stabilized. And that's a word to remember, stability. If the person cannot stabilize without medication, that is a time to introduce medication. If they are unsafe, then that is a time to introduce medication. But if it's just discomfort, it does not mean medication needs to be the answer. Another thing to remember is that there are no mental health medications that were made for children. None of the medications were made for children. There are medications that work better with children. There are medications that over time we have figured out work even better with children than they do with adults. But none of these medications were designed for children. And the reason I mention that is because every mental health medication has a long list of side effects, potential side effects and probable side effects. So it's important to keep in mind that if you introduce a medication, it could be that you deal with one of the problems that is going on and then another one pops up because of the medication. And that is why it's important to not just add medication or throw medication because there's some discomfort. Because if you throw medication at discomfort, that one discomfort may go away, but it's going to cause another, likely more extreme discomfort because of a side effect of the medication. So keep all of that in mind. And that when you keep all of that in mind, try therapy first. Therapy with a good therapist, a licensed therapist, someone who really knows what they're doing. Try that first. With my clients, I have a policy that they have to work with me for at least 3 months before we will choose to introduce medication, unless it's a situation of dangerous behavior or something where something really bad could happen. Then we'll talk about it. But for the most part, they have to work with me for about 3 months before we'll introduce medication. Most of the time, that therapy is good enough. And it could be they need to continue in therapy, but now they've learned over this 3 months of therapy to mitigate some of those symptoms that they were feeling. And so now they don't feel the need to introduce that medication. Had we introduced medication right at first, then we would have introduced the medication. We wouldn't have known what help the therapy was doing and what help the medication was doing. And then there also would have been these side effects that were popping up on the other side of things. It causes a whole mix of difficulties when you introduce medication too early, or if you feel like medication is a solution, because it's not. So try therapy first. If you do that and it's not working or the behaviors are still extreme, ask yourself a couple questions. First off, is this a good therapist? That's an important question to ask. And second, okay, now that I'm still seeing all these things, would it be helpful to have a discussion about introducing medication? But medication should not be the first thing that we introduce. Medication should not be the only thing that we introduce. And it should be with the understanding that medication is not a solution. It's part of a support system. And we're going to need to keep that system going. And then hopefully over time we can back off some of that medication. Keep all of that in mind. And I would say if you have concerns that your child needs mental health medication, your real concern is that your child needs mental health help. And if you have that concern that your child needs mental health help from a professional, take them to a professional. Get them assessed, get them diagnosed, and be very wary of therapists who want to introduce medication the first time they get to meet you. If that's what they're doing, I just don't trust it very much. That's just my opinion.